So Social Security is with you through life's journey. That's sort of like our branding. When you're born, we not only assign your Social Security number, but we record your baby name. It's actually a huge part of our website. It's one of the most frequently visited. It's on the Today Show. So if you're ever interested in looking to see how popular your baby name is, you're welcome to do that. And then as you start to work, we record your earnings history. And if the unfortunate should happen and you become disabled, we pay disability. When you're ready for retirement, we're here for you. And if you should pass away, we're here for your survivors. So we say we're with you through your life's journey. So Social Security was never meant to be your entire retirement income. Social Security is a sort of like a stepping stool, along with any pensions that you receive from your employers, any savings and investments that you put aside, and then some people have other incomes like VA benefits or spousal benefits. All together make your Social Security income. We say Social Security is the stepping stone to that because it's one of the only ones that will continue to increase with cost of living throughout your retirement history. What is FICA? Federal Insurance Commission Act. It's also the deductions they take from your payroll. Right now, it's at 15.3%. You would pay a portion and your employer would pay the other portion. This would go into Social Security, Medicare, and some general government funds. So the FICA wage right now, or the FICA tax rate is 15.3% total. How do you qualify for retirement benefits? You have to earn what we call credits. They used to be called quarters of coverage, but now they're more commonly known as credits. So for this year, one credit is $1,730. So if you've worked and you're putting into Social Security and you earned $1,730, you have a credit for this year. If you've worked putting into Social Security and earned $6,920, you have 4 credits for this year, and that's the maximum you can make any year. You need a total of 40 to qualify for retirement benefits. So they say about 10 years of work. You can make 4 credits a year, 10 years of work, 10 times 4 is 40. Once you have your 40 credits, you qualify for retirement benefits, even if you stop working, even if you put into something that's not investing in Social Security, we still keep the credits and they will be there for you when you're ready to retire. These credits can be earned all in the first day of the year. They can be spread out throughout the year. It doesn't matter when you earn them as long as you earn them within the year. Full retirement age. I know it got picked on a lot. It got spread out a lot. This is the final chart here. This hasn't been changed for a few years now, but the full retirement age was extended from 65 to a number of different ages depending on the year that you were born. So if you were born in 1957, it's 66 and 6 months. The first day of that month that you turn 66 and 6 months, you're considered full retirement age. So depending on the year you were born, that would be your full retirement age and when you could collect 100% of your benefits. So what is the best time to retire? This is the question, the magic question that I always get asked. When's the best time? Well, the answer to that is so very different for everybody. So many things go into that. What other income you have, who you have to support, what your life expectancy is. So many answers. So I wouldn't be able to tell somebody when the best time to retire is personally. However, I can tell you that the earliest that you can retire is age 62 as a regular retiree. And that would be about 75% of your benefit. If you wait till your full retirement age, again, I said that's 100% of your benefit at full retirement age. And some people wait even past that till age 70, where you can get up to 132% of your benefit. Past 70, there's no reason to wait. There would be no increase except for cost of living. You'd actually be losing out. And then anywhere in between any of these ages, you can retire. It goes up dollars every month and percentages every year. So you can select any time in between those 3, but those are the 3 main ones. Early is 62, 75%. Full retirement age is 100%, and then 70 is 132%.
So do the cost of living raises each year get a portion to people who are 62 and over into their benefit and keep accruing?
Correct, right, so every year they would be applied even if they're not, collecting benefits, we apply them to them.
Thank you.
So, this example here, this person is full retirement age at 67, and their full benefit rate is $2,000. So if they started at 62, they'd get $1,400 a month. Once you select your benefits, that is your benefit. It will continue, and the only thing that will increase it is work or cost of living. If they waited till full retirement age, they'd get the full $2,000, and if they waited till age 70, they'd get $2,480 a month. And so, again, in between there, you can go at any time, but these are the three main points. I think there was something else I wanted to say about this screen, but I can't think of it now.
When you say it's 2,000, is that before or after taxes?
This is before taxes. Everything is before taxes. Yep. So you can also work and receive your Social Security benefits. So if you're under your full retirement age, you can earn $22,320, and we'll take $1 for every 2 you make over that. These figures are for the year 2024 because they do change. Once you're in the year of your full retirement age, so January till the month that you turn to your full retirement age, you can earn $59,520, and we'll take $1 for every 3 you make over. And then once you've turned full retirement age, we don't care what you make, okay? You can make $1 million a month and you don't have to report to us. You make $1 million a month, I wanna know where you work, but Social Security does not care. So, you're able to work full-time and still get 100% of your benefit.
But you do pay taxes on it.
You do pay taxes. Now, I did hear a few things about people who collect a pension not covered through Social Security. So I'm just going to point out that if you're somebody who is still working at your full retirement age, you can file for Social Security benefits even though you're still working and earning. So because you're not collecting your pension yet, you would be collecting, because it's full retirement age, 100% of your Social Security benefits. And then we will not do any offset until you retire and start to collect your pension. So it is possible for you to collect 100% of your Social Security, still working, and then once you file for your pension, then we would apply the reduction. How do we determine how much Social Security they pay you? Well, this is a very simplified version of the formula. But just so that you get the gist, we take your earnings record and we use the highest 35 years, okay? So we take a look at all your earnings and we take the highest 35. Well, what if you haven't worked 35 years? What if you have some 0 years or some very low years? They average that out to show that you at least made the poverty level for that year. Now, because Social Security is geared to help the low-wage earner, you will receive a bigger return on those earnings. So they take a look at your earnings record, they choose the highest 35, they average out the 0 years and the low years, and that's how they get their average index monthly earnings for you. This, again, is a very simplified version. If you want to do the entire thing out, you can go to the link on our website. You will have to have all of your earnings in front of you, and I would set aside a bit of time. I hope you like math. There's a lot of formulas, but you can figure it out yourself. The Social Security statements are back. They are now sending them to individuals 60 years old and closest to retirement. Unless you have a Social Security account, then you can print them at any time. But if you do receive one in the mail, they do look a little different. They're more colorful. They have more information. They may come with a supplemental page that's geared towards your age to help you know some of the things that you should be looking out for. But they are back in the mailboxes. We also have a retirement calculator online. Now, our retirement calculator is probably our most popular tool, especially with financial advisors. This allows you to answer a lot of those what-if scenarios, like what if I stop working in June, or what if I wait till October, and what happens if I'm working? So you can punch all of these things in and see how it will all affect you. It will see the differences between the ages and the dates. It's interactive, so This tool is pretty popular, and if you're someone who has a pension base not on work covered by Social Security, you can also go to that section and figure that out. This is our new website. It got a facelift this year, got a bunch of new colors. It's supposed to be much more user friendly. So now it's geared towards prepare, apply, and manage your benefits. If you're preparing, there's some information like calculators and things. If you're ready to apply, all our applications are in that section. And if you're already on and you're managing your benefits, you can go into that section there.
On the place where you can do the calculator of benefits, can you do that for example, like I have a widow's benefit and put that in? And to see whether you should collect that now and then your Social Security later, or vice versa?
For the details, the very details like that, you would want to make your own account. Now, it does do you and a spouse. It can also do some widow's benefits, but widow's benefits are one of the only ones that we don't do online. They're very complex, and you would have to talk with an individual to apply for those.
Okay.
And we'll go over widows, and you'll see why. It's like a lot of different rules.
Yeah.
So these are how you create your own accounts. The My Social Security accounts you can create on our website. The very first time, of course, you're going to have to go through security measures and passwords and all of that. But once you have established your account, there's so much that you can do on there. So if you're receiving benefits, you can get a duplicate Social Security card, a Medicare card, your 1099, which tells you the benefits you receive that you would use for your taxes, to change your direct deposit, your address, pretty much everything. You can get a benefit verification letter to verify how much you receive. If you're not getting benefits, you can still do a lot on there. Also get a duplicate card. You can also get all those estimates that are on the statements. If you want to file an appeal, all of that is available. You can also get a letter saying that you don't get benefits. Now, we've received a large uptick in people asking for those letters. Not sure why yet, but many people are requesting letters that prove that they don't get benefits, and you can print it on your own now. We also pay benefits to the spouse. Now, a spouse is eligible for 50% of the unreduced worker's benefit. So if my full retirement amount is $1,000 and I'm married, my spouse is eligible for $500 a month if they file at full retirement age. Anytime you file prior to full retirement age, you're going to receive a reduction. So at full retirement age, they're eligible for $500. Now, if my spouse's own benefit is higher than that $500, they're going to get their own. It's not both. It's the higher of the two. Okay? So they'll look at the benefits and they'll say, okay, what is their own benefit? What is half of their spouse's? And then they will pay out the higher of the two. Okay? Now, this does not reduce any payment to the worker. I will still receive my $1,000 and my spouse could get the $500. There's no reduction to me. And if a spouse is caring for a child and under the earnings limit, then they can receive the benefits early.
So in other words, you can collect your benefit and your spouse collects his benefit.
Correct.
But you can also get half of your spouse's.
Yes. Well, not both. It will be the either or. The higher of the two. So they'll look at your own benefit and they'll look at what half of your spouse's is and they'll pay out the higher one.
Oh, all right, so if mine is lower than my husband's, and then I get half of his and it's higher than what I'm getting, then I get his.
Correct.
Yeah, so that didn't happen when I applied for my,
And
so you have to apply for that?
they would have done the spousal benefit when you applied. You're supposed to apply for everything you're eligible for.
Well, at the time, I didn't know about this.
Yeah.
So I
How-
didn't
how are we supposed to
specifically,
know?
yeah.
If the law changes from one year to the next, which it does, how do we find out as
Well,
individuals?
spousal benefits haven't changed.
Well, I'm
These have
just
been,
saying.
yeah.
But is that supposed to be automatic?
Right, so when you
So
come
that
in to
didn't happen when
file,
I filed.
they're going to ask you about your marriages. So you would have had to say I was married or I am married or any of that, and then they'll check all of that then. If you didn't qualify, then they wouldn't have paid you your spouse's. They would have paid you your own. So if yours is higher than half of your spouse's, they would have
But
paid you
how would I
your
know that? I don't have,
They will do that out. That's what we do at the office.
I don't know, I just applied
Yeah,
Didn't know
So
I could
it's
do that.
part of the process. Once you tell us your marriage information, they're going to check all of that.
So it's automatic?
Yeah.
So in other words, I'm not privy to it, but it's being done?
Well, you probably didn't qualify. Yours was probably higher than your spouse's.
No, his is higher than mine.
Half of his is higher than yours?
I don't know, I'd have to calculate.
Yeah, so they start with half of his, and then they'll see how much yours is. If half is less than yours, you're gonna get your own. And if you retired earlier than full retirement age, it would be even less than half of his, because you get a reduction.
So how do I find out about this?
Well, you can call the 1-800 number and see if they filed, but I mean, it's part of our process.
Can I just ask you, so I know you got a new website, I'm not really like a computer person, but if you wanted to do a paper-based application, is that still possible, or is it only online?
No paper applications anymore. You're either gonna do it online or you're gonna do it on the phone with somebody.
Can you do it in person with someone still?
They're not at the moment taking in-person applications. Well, all of them are on the phone unless there's a special situation.
So if a spouse is making less than 50% of their spouse,
Mhm.
if they retire first, do they have the option of taking the higher benefit? Or do
So,
they have to wait for the spouse with the higher benefit to retire and file?
a current spouse would have to wait till the other person filed to get their spousal benefits.
Okay,
So if I came to the Social Security office and I'm married, but my spouse hasn't filed yet, they're just gonna give me my own. When my spouse then files, they will ask that person, are you married? And when they say yes, then they will say, okay, we're gonna link the two records and see which one is higher for the spouse.
okay.
So I know before you were talking
So
about
now
limits
it's
of how much money you can make every
sides
year.
first.
So is it kind of, I guess, more geared towards
So I
people
don't
who are
know.
not
Right.
self-employed,
So I don't know
or
what-
just
yeah,
self-employed
so I don't know
people
what happened.
are part of the same number?
Yes,
That's
they're
always been
part of the same
question.
numbers, they just report differently. We would have to,
Oh, okay,
but
okay.
same thing.
Mhm.
Okay. So we also pay divorced spouses. So if you were married at least 10 years and you're 62 and your ex-spouse is at least 62, you can file for divorced spouses benefits. It doesn't matter if your spouse has remarried, as long as you haven't remarried. But if you're unmarried, you're at least 62, you were married for at least 10 years, you can file for divorced spouses benefits, and it's the same criteria. If your own is higher, you're going to get your own. If not, they will start with 50% of your ex-spouses.
But you had said that if the person was married, you have to wait for your spouse to file before you can collect on their benefit. How does it work with an ex-spouse?
So if that person's married, they would have to wait. But if you're an ex-spouse, as long as that person is at least 62, you don't have to wait. No. So, and that's the difference between a current spouse and an ex-spouse.
Okay.
So a current spouse has to wait, but an ex-spouse does not. So if you get a letter in the mail, because of the privacy, it's just gonna say someone is collecting on your benefit. We also pay survivors. So if you are widow or widowed, a widow or widower, you can receive survivors benefits. Now, we talked about how spouses were 50%. Survivors are 100% of the number holders benefit as long as they file at full retirement age. Always full retirement age is when you get 100%. So if my spouse should pass away, at full retirement age, I could get 100% of the benefit. I could also file earlier as a widow. I can start at age 60. It would be 71.5% of the benefit. If I am disabled, I can start at age 50, but 60 is only for survivors.
So in filing for that, it says your full benefit. You don't have the choice of your spouse, your former spouse, or your own benefit?
Yeah.
Oh, you do,
So,
okay.
yeah, I gotta keep going.
Okay, sorry.
So that's okay. So 50 for disabled, 60 is early for widows and widowers. If they wait till full retirement age, it's 100%. And widows and widowers are one of the only ones that have the option of moving back and forth on the record. I can say, well, I'm 60 and I really need the benefits right now because I lost my spouse, and I can start to collect 71.5% of that benefit. And then when I'm full retirement age, I can switch over to my own at 100%. So widows and widows are the only ones that have that option to do that.
But if you're still working, it's gonna be,
Right, you have to be under the earnings limit
Yeah.
and, age requirements always.
So I'm sorry, you get your own, but if you claim your own, then you can't get your survivor's benefit anymore?
It's either or, you won't get both.
Okay.
So just to recap, living spouses can start at age 62, survivors are at age 60 unless they're disabled, at 50. 50% for spouses, and for survivors, it's 71.5% at 60 or 100% at full retirement age. We also pay children on the benefit, so if you are retired or disabled or deceased, and you have a child that's under age 18 and unmarried, they can collect on your record. Again, it will not affect your benefit. You will continue to get yours, but your child can collect as a student all the way till age 18. If that child is still in high school at age 18, they can collect until 19 and 2 months or graduation, whichever one happens first. And if that child files for Social Security disability benefits prior to their 22nd birthday and they're approved, they can continue to collect on your record throughout their adult life, as long as they meet all the criteria of earnings and marriage and all of that. Will you be taxed? More than likely, yes. Most people are taxed federally on their Social Security earnings. These are the thresholds. I actually took this from the IRS website. We're not the IRS. We don't do the tax stuff, but they are taxed. We can pre-tax if you should select that. If you wanted to pre-tax your benefits, they'll give you a sheet and you select what percentage you want to pre-tax, and we'll withhold those. But you get the 1099 at the end of the year, very much like you get your W-2 at the end of the year, and you would file your taxes with that. Medicare. Medicare for most people is going to be at age 65. You're eligible for your initial enrollment period 3 months before your 65th birthday, the month of, and 3 months after. Okay? That's for Medicare. Now, what happens if at 65 you're still working? You're still covered by a group health plan. Or your spouse is working and they're covering you by a group health plan. Well, you don't want to have two insurances. So at 65 you can say, no, I don't want Medicare right now. I'll wait till I need it later on. That's at your initial enrollment period. You can also say, I only want Medicare Part A right now because there's no premium for it. It will become secondary to whatever I have, and then I'll keep my insurance and I won't have to pay anything extra. So you have two options at 65. You can say not right now, or you can say I just want A. Now, once you stop working, or your spouse stops working and they stop covering you, then you have 8 months to let us know, and we'll put you on Medicare Part B or A and B, no penalties, okay? It'll be effective the next month after you apply. So at age 65, you have an enrollment period if you like. You could say no, or you can have a special enrollment period when you lose your group health plan and your employer. If you don't do it at 65 and you don't qualify for that special enrollment period, you're subjected to a general enrollment period. And that's January, February, March of every year, and you may receive a penalty for every year you could have had it and didn't. Okay? So you want to stay away from the general enrollment period if you can, so either at 65 or when you stop working. Now, we won't reach out to you. You will have to contact us.
So, when it comes to evaluating, whether you should stay with your employer's plan or go on to Medicare, does Social Security help you run those scenarios? Can they do that?
No, because we're not Medicare. We go hand in hand with them. We do their enrollments and billings.
Yeah.
So we can't, we don't have that much information on Medicare. You would either contact Medicare, or I don't know, is there a Shine representative here? Okay, because they're amazing.
Yeah.
I contact them a lot of times.
So, supposing you just want Medicare Part A, you turn 65, but you wait 3 months, can you not get on Part A?
So you elected it at 65, the Medicare Part A?
Well, you turned 65.
Yep.
And you did elect Medicare because you were still on your,
Yeah. And you just did the A?
well, I did do the A.
Okay, you didn't do anything? Okay.
Right, so can I get on the A now, or Because I'm still working.
Okay, so you didn't do it at 65, at 3 months before, 3 months after, and 3 months after your initial enrollment period, you're saying you want to get on Part A.
Correct.
I don't know, I would have to find out. Because those are the enrollment periods, but because Medicare Part A doesn't have a premium, it may be different. So I can actually get back to you on that, and
Okay.
I can send you the email
Yeah.
that answers that question. Okay, so I'll double check that. I believe that you can, but I'm not positive,
Okay.
because Medicare has their own enrollment periods. And I will send you an email about that.
Okay.
Okay, so initial, special, and general are your 3 enrollment periods. You wanna stay away from this guy right here.
What is A?
Oh, yeah. So Medicare has different parts. Medicare Part A and B are called Original Medicare, and those are the ones that we do enrollments and billings for at Social Security. So Medicare Part A is hospital insurance. It covers inpatient stays, skilled nursing, rehab, anytime you're hospitalized. Okay, so if you have another health insurance in Medicare Part A, it'll be secondary to that and may pick up some costs. The only time that they do not recommend that you have just Part A is if you're working and you have one of those health savings accounts. They do not go together. You would have to exhaust your health savings account first before you get on Part A, because they won't allow you to use it once you're on Medicare Part A. So that's the only disclaimer. But Medicare Part A covers hospital insurance when you're actually in the hospital inpatient. And Part B is sort of like the meat and potatoes of your Medicare. It's your everyday, it's your specialists, and all of that. Together, A and B cover about 80% of your healthcare needs. Now, for the other 20%, which include prescription drugs, you can sign up for a Part D plan. Those are outsourced. You would go to either where you get your prescriptions and talk to them about the different plans, or again, your Shine representative. To sign up for a Medicare Part D plan. And then there are some supplemental insurances, Medigaps, that they call Medicare Part C. And Medicare Part C are outsourced as well. They're different insurance companies who will offer you different things like that will wrap A, B, and D all together, one premium, and they may add something else to it. Okay, so the health insurance is a little bit of investigating, a little bit of research. Again, I always recommend the Shine representatives. And so the A and B you would do through us. C and D's would be outsourced to other plans. Okay? If you are someone who works for the city, state government, municipality, they usually offer you a supplemental plan. We cover 80% at your retirement. That would become primary, and then the plan they offer you would pick up the other 20, and that would be secondary.
So Part B isn't wrapped up in the other type of plan you would choose if it was a Medigap or a Medicare Advantage?
It could be, like each of those insurances in the Part Cs will tell you what they're going, most of them do wrap the A and B in whatever they're offering and
Yeah.
put it all together.
Well, my concern is that you've got to sign up for Part B before you even know what kind of plan you want. That's what it sounds like.
Well, you wanna get in those enrollment periods.
Yeah.
So when it's time, if you wanna do it at 65, then you wanna start looking into it before that. And if you're ready, when you're ready to retire, I mean, they're gonna send you a million things, and even your HR, all of that is gonna start sending you stuff on insurances.
Because I get calls from people that are kind of nervous about, I'm worried about signing up, and I gotta sign up, and I recommend that they talk to the Shine counselor before they even sign up for Part B, because you don't know what insurance you're gonna have.
Yeah, and the Shine representatives have a lot of programs that they give them that will help navigate these things, where they can just punch in your information and it will very easily show them the different tiers and the different things that it could help you with. So I recommend them always.
I just have a question. So when you're talking about Part A and Part B and the health savings account, some places it's mandatory to have, so even if it's mandatory, you still have to take out all that money before they'll assist you through the Medicare?
Yeah, so I don't know all the rules on it, but I do know that they will not allow you to have the Medicare. Once you have the Medicare A, you're not gonna be able to use that health savings account anymore.
Because it was some places it's mandatory, they have to get it, so.
So maybe like when you're closer to that retirement age, maybe not put anything in it. I don't know if that's mandatory, but you would have to talk to the HR.
Well, I mean, I know if you don't use it, you can get, some money off of it, like you get added to it, like change,
Yeah,
so.
yeah, I've seen that too. Yeah, this is definitely something you wanna talk to them about when you're ready for Medicare. The standard Medicare premium for this year, 2024, is $174.70. That's what everyone will pay monthly, individually, for Medicare. Medicare is individual, there's no family plans, so each person that's on the plan will pay $174.70 a month. Okay? Now, if you're someone who is in a higher income bracket, you will pay more for your Medicare. So, these are the income brackets. If you're in the second one, then you're gonna pay the standard premium, $174.70, plus an additional $69.90 monthly. There's one for Medicare B and there's one for Medicare D. So, we wanna, definitely take a look at that when when you're ready to sign up for the Medicare. Most people will pay the $174.70, but some people will pay more. Now, because,
So, people who retired earlier, who are paying a lower price when they first retired, does that keep increasing? So now they're paying 174, or was it cut off for them, so they're paying when they retired, that amount of money?
everyone gets a 2-year look back when they're on Medicare. So when you're on the Medicare program, they look at your earnings 2 year back. So even if you're already on, they're gonna look at your earnings 2 years back and say, what did you get for income, and then put them in these brackets.
No, that wasn't my question. My question was, say I retired 10 years ago and I'm paying $150. I started off paying $150 for my Medicare Part B. Has that been going up? And now
Everybody is
everybody
subjected
goes
to
up?
this, get the
Okay.
2-year look back.
Okay.
Yep. So, right, so because they look 2 years back, a lot of things could have happened 2 years ago. So if something happened, like, 2 years ago, what if you sold your house? Or what if that's the year you retired and they gave you like a golden handshake and they gave you some extra income? What if you cashed out your sick and your vacation and all of that? But that's not regular, that was just that year. You can apply for a life-changing event that says, that's not my income, that's not my correct income, and they will assess it and give you the answer.
Is that the title of the first part? Sorry, is the title of the first part the name of what you were talking about?
It's
Oh, this one.
adjustment amount of life savings event,
Oh,
yep.
okay.
And you can do that online, you can fax it, mail it, whatever exists for you. So with the prescription drug plans, if you are someone with limited income and resources, so if you're below a certain threshold, we can offer help with those Medicare Part D plans. You would apply for them online or in the office. If you qualify, then we can help you with up to $5,300 a year with your prescription costs. So these are the Medicare cards. If you have one, then you have seen these before. If you are applying in the future, your Medicare card should have a Medicare number. In the past, we used to, tell everybody, don't carry your Social Security card, it's so dangerous, and we'd drill this into everyone, and then we'd give you a Medicare card with your Social Security number slapped across the front. So it didn't make any sense, and so they finally updated these, and now you have a Medicare number, and most health establishments will recognize that. The advanced designation of representative pay is new. It came about after the pandemic. Because during the pandemic, there were many people that were hospitalized for long periods of time. And our rules state that if we can't get a hold of you, we need to suspend your benefit. So we had to suspend some people's benefits because we didn't know what was going on. And so when they suspend your benefit, they also suspend your health insurance. So that was a big predicament for someone who was laying in a hospital. So now we've added the advanced designation of rep payee. So if you have your own account, you can designate somebody. It doesn't give them control of anything. It just says that if we can't reach you, then there is someone else that we can reach. And then if something should happen where you're unable to handle your own finances, that's the person we would look for. And we take our fraud very seriously. You can report fraud through the phone, online, through the mail. You don't have to say your name. It can be anonymous. You can say your name if you like. But our Office of Inspector General takes them very, very seriously. All allegations are looked into. It may not happen the next day, but they will investigate everything. How do you apply for benefits? The fastest way is online right now. I know not everybody loves online. However, it is the fastest right now. If you apply online, there's about a 2-week turnover. 90% callback rate, where someone will say your first check is on this day, going to your bank account, or we need more information. We're mandated to review every case that is turned in online. Make sure that you're applying for everything you're eligible for. You can also schedule a phone appointment. You call the 1-800 number, 1-800-772-1213. They open at 8 and they stay open until 7. Off-peak hours are best. Not a lot of people know that, Monday through Friday. You give them your zip code. They will schedule an appointment for you at a day and time. So they'll say like Monday at 8 a.m. Someone will call you. In-office appointments right now are only for special cases. We are still working a hybrid, which means half of our office is at home and half of our office is in the actual field. So in order to make it fair for everybody, phone appointments, everybody is accessible, okay? So that will also allow us to do more appointments a day if we do them on the phone. And so, like I said, in-office appointments are only for special cases. And we are on social media. Social Security is pretty cool because I'm not on half of this stuff, but they are. They're on Facebook, Twitter, Instagram, LinkedIn, and YouTube. I've gotten a lot of good feedback on the YouTube videos. They're short, sweet, and very easy to follow. So if you like YouTube, then definitely you can get on there. That's it for me. I'm sure there are questions.
Thank you very much.
You're welcome.
Thank you.
Go. Yes.
Okay,
No,
Rachel.
I didn't know if you had a question or you.
Yeah, she
Oh, I
did.
do.
Okay. Yes.
Yeah, I'm a retired teacher and collect a pension,
Okay.
so, and I've been married for 10 years, I'm the ex-spouse, so how did that?
So as an ex-spouse, you qualify if you were married 10 years. So what they will do is they will look at that benefit. They'll start with half of his, right? And then because you're collecting a pension, not covered through Social
Right.
Security, they will apply that government pension offset, which states that 2/3 of your gross monthly pension will come off of what you're eligible for. So that can potentially wipe out that divorced spouse's benefit. On the windfall elimination provision, which affects you on your own benefit, you're guaranteed 40%. So there is a guarantee there that you will collect. But on the government pension offset, which affects spouses and widows, there's no guarantee. It could wipe you out.
So should I make a phone call, I mean, should I?
So if
That'd be
you,
the best
if
thing.
you have filed, they would have looked at it, but if you haven't filed yet, then, right, you would wanna know what your gross monthly pension amount is, and then you can either call the 1-800 number, or you could use that online calculator, whichever one you prefer.
Oh, I just have a question. I know today, there's going to be Tuesday, April 16th, a congressional hearing on the WEP and the GOP. You're familiar? I'm sure the meeting's over now. What do you think the chances are of anything happening?
I don't have a crystal ball, but I mean, at Social Security, we're rooting for all, we're all on the same team. A lot of man hours go into this, a lot of calculations and things that we have to do in order to apply the windfall in the government pension office offset, things that other states don't have to do, as we all know. So we are rooting for the same things. However, it's up to them.
What's the
Up to the vote, up to Congress.
What's the WEP?
Windfall elimination provision, it affects individuals who work for city, state, or government municipality, and they didn't put into Social Security, they put into a separate pension. However, most of these individuals had time in the private sector where they did put into Social
Yeah.
Security. So now,
And they eliminate, they don't get their full
Yeah, no,
social security.
Massachusetts doesn't
Yeah.
allow you, yeah, I know that.
so I don't know, I'm here with you,
Well,
so.
thank you.
I have two questions on
Oh,
that.
sorry, go ahead.
So, currently as it works, you have your social security, you know what you're gonna get at full retirement age, and then you have the pension and the pension offset. So if you're full retirement age, for example, you're gonna get $2,000, and then you have a pension offset. Will the pension offset with the social security together bring it up to what the $2,000 would have been, or is it gonna be less?
So the pension offset, plus your pension, you mean? So
Yeah.
the Social Security after the offset plus your pension?
Yeah, is it gonna come up to that $2,000 that you would have gotten with full social security?
No.
So you're penalized, you're.
I mean, it can, but it's not a guarantee.
And why is that? Because
So-
you've worked for those credits, and if the pension is to make up the difference, not necessarily to take away, isn't it?
So the answer is, whether it's agreed or not, the answer is that back in the 80s, when they voted on putting this windfall in, the reason for that was because they felt that the people who put into a separate pension had an unfair advantage. Because we take, when I was talking about the formula, we take the 0 years and the low years and we inflate them to show that they did make money that year, and then you get a higher return on that because now you're considered a low wage earner, which gives you a higher return. So they felt that they were having an advantage.
Double dipping.
Yeah, double.
There's all kind of
You get
words
like
for it.
80% of your
However,
income.
to this date, not every state applies it. So there is that argument.
So does Massachusetts apply?
Oh, they definitely do. They're one of the last ones.
Yeah.
Even if you move somewhere else, it's where you earned it, so it will follow you.
Yeah. So the second question is, if they do change it at the congressional level, will they go back retroactively to people who already put in their
They've
retirement?
all,
I
that would
doubt
all have to be in the bill. So they would all have to, that would have to be in the bill. Whatever they write up on that bill is what will be applied, whether they grandfather, whether they go back.
Is that a consideration right now, though?
That's
I
a
don't know.
consideration for not
Okay.
passing it.
Right.
That's
that-
been openly discussed, that they can't do that. So it's
Yeah.
unfair to everyone, so keep it as it is.
I don't even know, I mean, the stuff that I do know about this, because my father's affected by this and I get nasty texts all the time. But he did tell me about that.
So it doesn't matter if you worked years and years and years in the private sector before you went into, say, a teaching career?
It does matter.
Oh, it does matter.
so-
Depends on your pension, what you're getting.
Right,
Okay.
so with the windfall elimination provision, the way that it works is they are looking at how many years you put into Social Security, what they call substantially. So every year Congress puts out a figure and they say, if you worked in 2024 and you made 30,000 and putting into Social Security, we consider that to be substantial. You have one substantial earnings year. Depending on how many of those you have total is the percentage that you'll collect from Social Security. So the WEP guarantee says anybody who is eligible for Social Security and has a pension, you're guaranteed at least 40%.
Of your
Now-
social security?
Correct. Now, if you put in 25 years substantially into Social Security, then you're going to get 45%. And it keeps going up until you're at 30 years of substantial earnings, and then you're exempt from that.
Oh,
It really penalizes women, because women tend to make less money, and it's really hard to get those substantial earnings. I know I don't have them.
That is.
oh, God.
So, going back to the spouse thing, so I did file before my husband,
Okay.
and I think I helped him with his, and I don't recall them saying anything about my, what I
Well,
was
they would
getting.
have asked him about his marriages. They would have asked him if he's currently married or if he was married in the past. So that's where we'll gather your information. And then at that point, if you're eligible, then they would have sent you a letter, or they would have said to him, please have your spouse, file.
Yeah, see, that, okay, so I have to call somebody to
You can
verify
call.
that, right?
Yeah, that 1-800 number, definitely, and you can verify for sure that, I mean, you know, we weren't there when you did the application, so I can't tell you for sure, but yeah. There's no
Okay.
harm in double checking.
Okay. Would it be retroactive if they made a mistake?
If it's our error, certainly, yes.
Okay.
When did the paper statements come back?
When or
Yeah.
why?
When, like if we're not getting them?
I think they started at the end of last year, because we got our budget in October, or we didn't. That's a whole nother ballgame. But that's when we're supposed to get our budget.
Okay.
So, I think they started back in October. And yeah, they don't go out to everybody anymore, but you can make an account and print it at any time. That's their sort of reasoning, but we wanted to at least get it out to people 60, from 60 all the way till, they file.
Can I ask another question? So everybody's always saying, oh, Social Security's not gonna last, it's gonna end in so many years, but has anybody ever addressed the fact that the Social Security was raided twice by the government? And do they have any intention of putting that money back? I doubt it, but
I wouldn't be able to
years
answer
ago,
that.
they raided it twice. And that's why there's a shortfall.
I just am not, I
Nobody
wouldn't have
knows.
any, right,
Okay.
the answer for that, sorry.
I get the Social Security kind of notices.
Mhm.
And recently it was said that for people who are being, where their Social Security is being garnished, that they wouldn't garnish any more than 10% of the person's Social Security.
That's new, yes.
Yeah.
We have a new commissioner and he made that law now.
Yeah, but it sounds like though that the person actually has to contact Social Security and not have it done automatically, is that true?
If they already have something established, yes, they have to call to change it.
Yeah.
But moving forward, anybody who has to pay back any kind of overpayment,
Mhm.
then the new rules would apply.
Yeah.
So
What-
and that's,
What are the circumstances that people might get caught in an overpayment?
I mean, if they're working and wages are not reported timely, you know, if we don't have the information, we're gonna keep paying regular, and then we have to go back and apply earnings. That's the biggest one.
Okay. So before you file for Social Security, you better check that you have all your earnings
That's correct.
listed.
Yes. And then, you know, there are some times when people fail to let us know things, like if they got married or all kind of things, and then those can result in overpayments. And there are some erroneous overpayments that, you know, have generated because of systems things, and those can be waived.
Okay, thank you.
My question to you is, if you were the higher wage earner and you retired and your wife retired, now, cases, or I'd say, if the husband was the higher wage earner and the wife wasn't, and the wife died, now, that means nothing comes to the husband, is that right?
Right.
Now, if the wife survives and the husband dies, and he's the breadwinner and he paid in more and everything, now, would they get that money?
Yes.
Why can't it go the other way?
It's the higher of the two.
Yeah.
No,
it's
I understand,
higher.
but if you're paying Social Security, and my wife is paying Social Security all those years, and then she passed away, which she did, so then I receive less money every month to pay the bills, correct? But
of course, yeah.
if the thing was flipped, she would get a larger amount
But you're
because,
still only getting one.
You can only get one or
In
the
your
other.
case, you're thinking you wanna get two. But
no,
in
I
Amber's
just,
case,
I
you
just
get
wanna
one.
know, no. So in other words, any of the money that she paid in, then that's just
Yep,
Right.
gone.
that's right.
So spouses benefits were made to address those people who stayed at home while another person worked. So that's why spouses benefits are 50%, and if your own is higher, then you get your own, because those spousal benefits were only made to replace for people who weren't able to work or couldn't go out and work because they were the homemaker. So that's why, you wouldn't collect on your spouses if yours is higher, because if your spouse went out and worked and they passed, that wouldn't be replaced. They're not with us anymore and their income wouldn't be replaced.
But it would work if the wife made more than the husband,
Right.
and then she died, then the husband would get half of her.
Yeah, the higher one.
So,
Yeah.
so that, in that case, it would work.
Yeah, I mean, I think
It just
he knows
depends on
that,
who
but
made
it
more.
was,
Depends on who's making more money.
yeah.
But that is always a tough thing, when one spouse dies and they have depended on two incomes, and now they have one income.
Absolutely.
And, in the past, in my former life, when I sold life insurance, that was the one thing that would help, is that, when the spouses had life insurance, that would be income replacement if one spouse died.
Yeah.
No, as we say, thank you.
$100,000 sounds like a lot of money, right? But
It's not.
that's
Not-
not.
Not anymore, not these
nothing.
days.
Everyone, I can't say everyone here sitting in this room is a millionaire. And they're gonna say, you're full of it. Take your house and take a few other things and add them up, they're close to millionaires, every one of you. So $1 million is not much.
No, $1 million.
Thank you everyone for your time.
Thank you.